Now let's study antidiarrheal drugs. So, what are the antidiarrheal drugs which we can use to treat diarrhea? First is opioids. In opioids, loperamide, which is a drug of choice for treating irritable bowel syndrome with diarrhea dominance. Other drugs which can be used is diphenoxylate and diphenoxine. One thing that we have to remember is loperamide is not a drug of choice in infective diarrhea because loperamide inhibit the gut motility. If it will inhibit the gut motility, then the bacteria which are excreting out due to diarrhea will not be excreted and the infective diarrhea will increase its flora in the intestine and the condition may be worse and the infection may spread to the systemic circulation. So it's better to avoid loperamide unless and until it is not required. First treat it with IV fluids, ORS, or with uh, drugs which can inhibit the the GI secretions. So unless and until it is not required, avoid using loperamide in infective diarrhea. We can use it in secretory diarrhea, but not in infective diarrhea. Next drug that can be used is loxodolin, which is mu and kappa agonist and delta antagonist, and these are opioid receptor. So also it can be used in irritable bowel syndrome with diarrhea. Next we can use is bile acid binding resins. So when we can use the bile acid binding resins in the biliary diarrhea. Biliary diarrhea means there is no time to absorb the bile secreted by the liver or gallbladder in the intestine. So there is change in color of the stool. The color may be the greenish stool, that is biliary diarrhea. The drugs that are used are cholestyramine, cholesavalum, and cholestibol. So choline is coming in these drugs. Next we can use is 5-HT3 antagonist, and that is ellocitron. And this ellocitron previously was used in irritable bowel syndrome with diarrhea in females, and it was causing ischemic colitis, so it is no longer used in irritable bowel syndrome with diarrhea for the treatment. Next we can use is octreotide. What is the mechanism of action of octreotide? It will decrease the secretion of gastrin and vasointestinal peptide, in short form VIP. And by decreasing gastrin and VIP, there will be decrease GIT contraction and secretion. What is the use of octreotide? It is used in secretory diarrhea, in HIV, diabetic mellitus, and in chemotherapy. We can use octreotide in pancreatitis also, and in dumping syndrome. Dumping syndrome is short bowel syndrome. Next, we can use the drug which I was talking about, resicadotril. This drug will inhibit the GI secretions. It inhibits the ancaphylinase, which will increase the enkephalin, which is an endogenous opioid. What other uses? It is used in children with acute diarrhea. Next we can use is crofalamer. The mechanism of action is inhibit CFTR gene, which will decrease chloride and water, and it is used for HIV associated diarrhea. One more thing that we can use for the treatment of diarrhea, we know already that we use ORS, we use IV fluids, we use an antibiotics ofloxacin or nidazole, and for increasing the healthy bacteria of the gut we use lactobacillus. Diarrhea is mainly caused when the gut bacteria, the healthy bacteria and the bad bacteria, there is disbalance, means there is increase in the bad bacteria and decrease in the healthy bacteria. So to increase the healthy bacteria which can recover the gut healthy environment and they can stop the diarrhea process, so we use lactobacillus. We can use biphilic. Biphilic is a kind of powder which comes in sachet, which is having probiotics that will improve the gut health, increase the healthy bacteria in gut. So these are the things which we use. And do not stop taking oral unless and until it is not denied by the doctor. So do not stop taking food, and in food, light food like juices, coconut water and soup, etc. So these are the anti-diarrheal drugs which we use. Thanks for watching this video. Hope you enjoyed this. Like, share and subscribe, please. Okay, thank you.